a resilient community is just a community that don't stop. You can keep on coming if you want to. You can have red lines. We can have food insecurity, but we're going to figure it out. We're going to keep going. We're going to keep moving. No matter what, we're going to be resilient and last through it all. And I mean, honestly, that's the heart of Detroit neighborhoods. And I'm using the word neighborhoods because that's important.
Well, hello. You are listening to the Health Disparities Podcast from Movement is Life. I am Ber Henda Williams. I'm a media producer, podcast host, womanist, cultural strategist, and I am here in Detroit, the heart of the city. And I was raised by this city through my parents, and I carry a deep respect and love for Detroit and Detroit communities. So today we are continuing the conversation about health, but not just the care, but the conditions. And I'm joined today by Dr. Caira Boggs, who is from Michigan Public Health. She is the director for the Michigan Public Health Institute Center for Health Innovation and Practice and Detroit Health Initiatives. This powerhouse oversees not one, not two, but 16 initiatives focused on health, equity, recovery, food access, chronic disease, prevention, and community-led grant making. Dr. Boggs, welcome. We're so happy to have you here.
No, thank you for having me. Happy to be here. Feel like I'm at home already.
Good. Good. Well, we're just going to jump right into it. You know, I think that the understanding of inequity starts very young. So if you can take us back to your first witnessing that there was something not equitable in my community, when did you first realize it in terms of even care and treatment of people that there was an inequity?
Sure. So I am Detroit born and raised. And so Detroit public school bred. And so in that space, I only knew my community. And so my community was amazing. It was all the things to me. I knew my neighbors on my block. They knew me. They knew my family. Our different families on the corner was into us, whether or not, it was the Flowers, the Syfaxes, whoever they were, and still great family friends to this day. So I had a nice hug. My teachers loved me. I loved them. Still can always reach out. Felt like that. And so my community was everything, and I thought no difference. I never knew it was anything that was different than others because all I knew was my community. I graduated from Renaissance, ended up going on to Bowling Green State University. When I got to Bowling Green, I saw a lot of differences. And so listening to other students and their experiences, the things that they did, they had access to, I'm like, oh, never. I mean, just minor things like having a pool at your high school. Like, I had a pool at your high school? Like, oh. Now, I knew there was others because sometimes we played a country day or something. But that was a one-off. It was a anomaly almost. Like, those are higher echelon type of things. But so being able to see the difference. And so in undergrad, I studied kinesiology, human movement science. And so I started looking more into health. And I was pre-med at the time as well. So I wanted to do sports medicine. And so I started seeing and reading articles, and it was different. It wasn't the same type of care. Starting to see how disproportionately, especially around maternal infant health, like, wait a minute, so you telling me that I'm at a higher risk when I decide to start a family and get pregnant just because I'm Black already? It didn't matter what I did. It didn't matter what steps I took. And it wasn't because my body wasn't healthy or I can not have high blood pressure or anything. It was just because no one took me seriously and no one would listen. And so being in those spaces and realizing I wanted to be a voice for people who look like me in health. And so as I went on, I'm like, these are like my aunts and uncles. So I started to see the people in my community and the research I was reading and the books I was going to. So I started to see a big difference.
Wow. And that does lead me into my next question about shaping your public health lens, because there is something different when you see a patient or a community member as a relative. Mm-hmm. This is my aunt. This is my grandmother. What would I want, or what kind of care would I want for someone that I love and care about? So as you're entering into, academia and higher ed, can you share with us a bit how that shaped your lens as you went into the higher ed spaces?
Of course, because it was never about me. It still isn't about me. I even sometimes shun when people are like, "Oh, Dr. Boggs." I'm like, "I'm just Caira. I'm just Caira from Appeline and 6 Mile and Myers." Like, I'm just not, I don't see those things, but I realize that having those degrees and going up is what got me in some of those rooms, right? And so when I do that, I speak for others, and I realize that really fast in those spaces, especially when it wasn't just me anymore. It was those who were a part of who I am that I speak of. Before I started getting more into public health, I did more employee health and wellness. And so for a while, I did employee health and wellness at Jefferson North Assembly Plant. And so one of my goals was to be able to essentially decrease absenteeism between, providing different health and wellness programs and being able to help with people, being on any type of leave or absence and things like that. And so I would do blood pressure checks. I would do walk-in things. I would do cholesterol checks. And so, I'm from Detroit, so everybody worked at a plant. So it was like the plant life. Now, I never had been inside of a plant, but once I started doing those things, so if I'm taking a blood pressure and I'm like, "Oh, hey, your blood pressure is quite elevated." And it was, "Oh, that's probably was just the food I ate last night. It's no big deal. I got to come back to work." And I was like, "Okay, but no, this is something you should follow with your physician about. You should go to your doctor about." And so because I resonated with so many of my family members who did work in a plant, I saw that and I'm like, this is bigger than just me, or taking the cholesterol and seeing that the cholesterol, was elevated or sugar levels were higher. Let's make sugar levels, because I say sugar instead of glucose.
That's right.
So glucose levels were higher and things like that. And so I really started to see like those people. And so I brought that as I moved into other spaces to realize that this is not just a community that I know of, or a community not even that I was accepted in, but a community I've been a part of. And that shaped that as I move.
So I want to name something as I'm listening to you speak. You're addressing something at the structural level, especially when you're talking about the plant. And we're here in the city. It's Motor City for a reason.
Right.
And as I'm hearing you speak, I'm thinking about many of us are assembly line babies. We wouldn't be here if it weren't for the assembly line. However, we love, the triple time and the overtime made great Christmas.
Oh, yeah.
But it does
profit sharing checks.
Come on.
A little something.
A little something.
Oh, and don't forget my B plan, because I get a discount.
Yes,
I get a discount on my car.
Love it, right? But you're talking about the things, though, then how does it impact the body?
Mm-hmm.
How does it impact attendance? How does it also impact the ways in which we connect with our family members? Because I remember my grandmother being a nurse at the plant, and she would work afternoons. So her sleep schedule would be a lot different. So I can remember I can't talk and play during the day because you don't want to wake up. I know your loved one that has to go into the plant. So of course, now that's kind of got your circadian rhythm off, and all of that sleep, food. I love how you said sugar.
Yes.
Look, all of that is impacted. So you are coming in with a heart in this space, in this very mechanical space. You're coming in with a heart to make sure that you're following up, that you're checking in, because wellness is not just that check.
Right.
It's nice.
Yes.
But it's not just the check. You're checking in with the heart, checking in with the well-being, which brings me to my next question. To you, what does a recovery-friendly work environment look like?
Oh, okay. So a recovery-friendly work environment is really a space where there's understanding. And so once again, and I'm not going to put it to the plants or anything, but we have, even just looking at our potholes in our streets, right? So you think about how many construction workers you see go by. So you have construction, you have automotive, you have just small type of mechanical plants. Even my father worked at Michigan Bell, which is not Michigan Bell at this point. It's Ameritech / AT&T, wherever it is right now. So he climbed poles. But those things around it, you continuously say those different people have struggles at some time. So whether or not it's alcoholism, whether or not it really is drug addiction, that affects people's families, right? And so we want people to be able to recover and re-enter in the workforce and re-enter in the workforce in a way that's healthy for them. So if I need to leave to go to my AA, how do you have this understanding for me to be able to do that? Understanding that maybe we shouldn't have alcohol at every holiday party because that makes a difference for a number of your employees. And then you wonder why it gets out of hand because maybe there's alcoholism in those spaces. So a work-friendly workforce really looks to me where people all understand. So we've all kind of be educated in this space. So whether or not you're a manager, whether or not you're over human resources, understanding what it means, understanding why Narcan is important, understand that even if it's not, when we're talking about addictions, it's not nothing that is a solution and it's done with. It's forever, It really is no different than if you're working with like cholesterol and glucose, things like that. You have to always manage those things and manage the environments that you're in.
Yeah. No, I love how you're bringing a dignity
Yes.
to the personhood. Sometimes when we think about recovery, whether it be, from alcohol or narcotics, it can have a bit of a stigma, to it and can make a person feel a bit outside of community or outside, quote unquote, normal interaction. But what it sounds like, the way you're programming and the way you've intentioned around it really centers the humanity of the person. Because we all have trials and tribulations.
Oh, definitely.
We might wear it a little different.
Yes.
Right. We might wear it a little different, but we still are worthy of respect and dignity, which brings me to my next question. When we contemplate health or being healthy and having a resilient community, what does that look like to you?
Oh, a resilient community is just a community that don't stop. You can keep on coming if you want to. You can have red lines. We can have food insecurity, but we're going to figure it out. We're going to keep going. We're going to keep moving. No matter what, we're going to be resilient and last through it all. And I mean, honestly, that's the heart of Detroit neighborhoods. And I'm using the word neighborhoods because that's important.
That is important. Let's name it plainly. For our people on 7 Mile to Better Mile, all the way, to the north end.
Yes.
Hamilton and everything.
Now.
Okay. McAfee, we're talking about the neighborhoods, our McGraw and Lawton's and Clark Park. So we can get into it.
Yeah, the neighborhoods. Honestly, if it wasn't for the neighborhoods that were resilient in all the spaces, it wouldn't be a Detroit that it is today. And that's important. Don't get me wrong. I love to come downtown and hang out. I love the Riverwalk. I like all those things that are now continues to beautify. But it's the neighborhoods that really is the heart of it. And it pumps blood to other spaces. But, our neighborhoods is great.
Shout out to the neighborhoods. Thank you so much for naming that. And so earlier you talked about sugar.
I know, right?
Right. So we do have to have some conversations. And sometimes these are hard conversations to have about diabetes and the way it disproportionately impacts communities of color. And we'll namely in this conversation name how it impacts Black neighborhoods. And you mentioned something earlier in our conversation. You said food insecurities. So what are ways in which that we can look at this from a structural, larger society vantage point? But then what are things that we can do? Because you named the resilience that resides inside the community. What are things that we can do on the individual level?
I really think that when you think about the individual level and food insecurity, it really is looking at your neighbor, looking to see those that are around, especially if you have more, right? How many times do you take your carry out from wherever you are and it just sits in your refrigerator? How many different restaurants and mom and pop shops do we have in neighborhoods and there's food waste, right? So figuring out a way to say, hey, if you want to come and get this, you can. I think Q's Kitchen, Cooking with Q, does a great job at that. Where like, if you hungry, we got it, even if it's just a bowl of soup, if whatever it may be. And so, and understanding food insecurity is where people don't know where their next meal may come from, or they don't have enough money in order to feed their family throughout the end of the month. So I may be If just because I'm eating a day don't mean I'm not food insecure. That's the other thing about it. And more than anything, I think people need to really understand and realize, even me as Dr. Caira Boggs and all that I am, I'm 2 checks away, right? We're 2-3 checks away of one bad decision, one layoff, things happening, whether or not it's a crash in the economy. And any of us, our life can change. So understanding that at the individual level helps you, just have a different level of empathy for other people and being able to give and think about those things. And so sometimes it's just a matter of, you see people like, food distributions or food giveaways, whether or not it's a Gleaner's Forgotten Harvest or someone else who may be sponsoring something like that. But somebody in your block who may have that need, but they can't drive and get there. So if you see a line, hop in the line and give it out, right? Mm-hmm. So it can be just small things. It doesn't take nothing big in the scale of things, or, even people experiencing homelessness. And so I'm very specific to say people experiencing homelessness, because you're not just homeless. Like, you're just experiencing it for now, and then something else can change because you weren't always in that space. Thinking of figuring like, how can I give you something, or how can I buy an extra meal? Does it hurt to do that? We always talk about paying it forward. And a lot of times we do it for those who are behind us that already would have been in line, but maybe we do it for those who could never even be in the lines that we're in.
Come on, Dr. Caira. I mean, let's just make this real plain, because I want to go back to the structural part, because we do have viewers, listeners that may be inside of corporations, maybe inside larger nonprofit organizations, or in more affluent school systems. So I love what you said about not just paying it for the person behind you. Even though we are the Motor City, we still have a transportation issue. So yes, we know that the Eastern Market will take an EPT card, but what if I can't get there? How do I get to the places that, will take an EPT card? Or what about our elders?
Yes.
I'm about to take it to church, sick and shut in.
Yes.
When we think about that, and even so many of our students are unfortunately labeled couch surfers.
Yes.
For those who are not familiar, many of our schools here.
Or think about how many major grocery stores we have in the city. Major grocery stores where I can go in and get a number of things,
You're absolutely right. And now many of the grocery stores have delivery systems. Mm-hmm. So what are ways that we can then maybe pay for a delivery for groceries, or cultivate partnerships, sponsorships with the grocery stores? Look, we're about to save the world, because, Black women will do it. Right. But you're helping us to contemplate, looking at where we are, the position of privilege, which is not a dirty word, but the privilege that we hold.
Oh, yeah, definitely.
And how can we use that privilege to help someone else? I love that. And so then this gets us into neighborhood solutions. Sometimes, especially in the time and space we're in as individuals, we can feel so helpless. Like, well, what can I do? This problem seems so much bigger than me and what I can do. But how do we put the power back in the hands of the people?
So I think it is just a matter of, and when you think about neighborhood solutions, especially in the space that we're utilizing it here at Michigan Public Health Institute, specifically with our Detroit Health Innovations work, is that, let's say that you want to be able to start a walking club. And for that walking club, you want to give out pedometers, and maybe you want to also have blood pressure checks or some really cool type of scales or things like that, or even just a fitness watch. I'm trying not to name specific things. That's right. So a fitness watch.
So no endorsements, right? No endorsements.
Yeah. But if you would like to offer endorsements, we'll figure out a way to make that work.
That's right.
But a fitness watch or something like that. But you always hear like, oh, there's money for these things. There's money for these things. But a lot of the smaller organizations, they don't have a way to be connected to those type of dollars. And I don't need $10 million. I just need $3,000 to buy this just for this little walking club or whatever it may be. Or maybe I can use another $1,200 for my block club because we want to hold a wellness seminar. Or maybe I want to do some after school tutoring because we noticed that the reading levels of our adolescents in our community is lower than what it should be, because we also know that education is a social determinant of health. And so being able to do some of those smaller things. And so I always say, start it up, do it, and tap into some of our community-based organizations that are doing some of that work. And so that's what we've kind of been able to do, is try to find anchor organizations that can be able to push dollars into the neighborhoods at lower levels. And so even with the project that we had like 7 anchor-based organizations funded through Michigan Department of Health and Human Services and also the Kresge Foundation, where we identified 7 anchor organizations. We really worked with them to be able to help them to be grant makers and what that looked like. And then they were able to identify some of those smaller neighborhood-based partners, and they gave funding to 68 of them. And so that's a lot, and a lot of work to just say, yeah, you may not have the infrastructure or fiduciary space to be able to take in some large dollars, but let's give them to some anchor organizations, to the people who know the community best. And so instead of making decisions at the top, having those decisions being made from the grassroots level.
Oh my goodness, I love that, and you made me think about the grass tops in our communities, and what you named again goes back to some of the structural issues. Is that many times the individuals that are doing the labor and the work every day just don't necessarily have the business infrastructure or the nonprofit status to do quote unquote nonprofit work. But where we're from, it's just called the right thing.
Yes.
You just look out
yep.
for the person to your left or to your right. Right. It's real simple. The neighbor behind you, you look out for your community. And so, wow, Dr. Caira, I mean, you are just a wealth of information and just an embodiment of compassion and care. And so as we begin to close, I'd like for you to think about, in your career or in interactions in the neighborhoods and in the communities, what was a defining moment for you?
Oh, I think, and I don't want to sound cliche, a defining moment for me was really in the COVID space. In public health and in health in general, dealing with something that was very devastating. We didn't know what was happening. We didn't know what was going on. I feel like it raised public health to the height of things. Never did you see, per se, the state health director on TV every day. It's like, wait, this is public health. This is what it means. It raised up, the idea of just tracking. And, we tracked before with like STIs and those type of things. But being able to have tracing and tracking and, raising up aspects around epidemiology and what that looks like. And so that was really defining for me, because I think once COVID hit, it really elevated the issues of social determinants of health in our communities. We were saying social determinants of health. We were yelling how important equity was. But it was really seeing where this is why, this is what made the difference, access to care. People who, if you were pre-diabetic or was diabetic, you was more apt to have more adverse effects from COVID.
That's right.
We were afraid and fearful, for our loved ones, those who were elderly, those who were younger, those who had different things. And so I think that was a really defining moment where it really allowed me to step back and say, this is why I do the work that I do. Mm-hmm. And I think before then, it was kind of like, you do what over there? You a doctor of what exactly? I'm like, health education. I'm trying to educate people in their health and raise it up and talk about why public health is important, because it's not just the individual. It looks at it in a collective space around what that looks like. And it looks at trends and things like that. And so I think that was really defining for me as I would say more on the professional level. And on terms of, individual levels, when I do have those aunts and uncles that I know could have been different. I know when health outcomes could have been different if they had different access, if they had different education, if they lived in different communities, and those type of things, and, financial abilities to make a difference. And so I think that there's been a number of defining moments, and I'm sure I'm not done with having them yet.
Okay. I'm sure you aren't either. So as we close out, as a bit of wisdom and advice as a health educator, what do you want to leave our audience with?
I just want to leave our audience with never forget that you can make a difference. Never forget that you can do one thing to change someone else's trajectory, change someone's life, whether or not it's just, it can be something as small as encouraging someone to go to the doctors. You know, we have so many men in our community. They're so busy being financial providers or things like that. They don't stop to go to the doctors. Or we have so many women that are busy doing it at all, making sure everyone else's schedule's together. They don't stop. So, you know, my advice is see something, say something, check on the ones that are strong, check on the ones that are weak. As you said, check on your neighbors, you know, you should know them on your block. And that's about, I think, is the best thing. And to just really understand that for a long time, we just wanted to be equal, have what other people had. And so now we're looking at being equitable, giving people what they need in order to bring them up to being equal. And that's the difference.
Well, let's go. Dr. Boggs, I mean, seriously, from the bottom of my heart, and Movement is Life, thank you so much for your leadership and the work that you do in the community to advance health equity across Michigan. And for our listeners, for you all to learn more about this amazing work that is happening, please log on to mphi.org. This has been the Health Disparities Podcast from Movement is Life. I am Ber Henda Williams, and until next time, take care of yourselves and stay healthy.